Welcome to Veterans Health Hub. And first, I just want to talk about the story that everybody's been talking about, and that's the incredibly cold weather that we've been having this winter. We're not used to it anymore here in Maryland. A couple weeks ago, when we had just a near catastrophic snowstorm, bigger than one we've seen in probably over a decade. And as we were in the grocery stores, buying our milk and eggs and making sure that, we had enough to sustain us in the house for who knows how long, there were veterans in Maryland who don't have homes, who didn't know how they were going to survive the storm. But here to talk with me about resources that we have at the VA Maryland healthcare system is Shanita Birch. And she's from our Community Resource and Referral Center, and that's an arm of our Homeless Veterans Program. So, Shanita, paint a picture for me. What was it like the weekend of that actual storm?
Whenever there is a catastrophic situation, kind of like the snow we had, the inclement weather, we work with our communities to ensure that any veterans that we know are homeless or houseless, we try to get to them as soon as possible and get them into some form of shelter. Even at the VA, at the main VA, we open our lobbies up 24 hours to ensure that no veteran has to stay out in the cold. They can come in, they can get a warm blanket, they can get a meal, and they can get an assessment so that they don't have to again return out into the cold, but we can find them shelter and they can go from a homeless and houseless place to a housed place.
That's awesome. And you didn't have a snow day either, you or
Yeah.
your staff. You spent the whole weekend at the VA, at the Baltimore VA.
Yes, what we did as staff, like you said, there were no snow days for our staff in the homeless program. We wanted to ensure that any houseless veteran, homeless veteran, or any veteran out there in the cold could get their needs met. So my staff and I were there from that Saturday evening all the way through that Tuesday afternoon, not only to meet the needs of our homeless community, but also to help out with staffing. It was difficult not only for our houseless vets, but also staff to get around. So we wanted to make sure that even the VA itself was fully staffed to meet every need that came through those doors.
Yes, and just an aside, what the general public doesn't know is that our hospital and many local hospitals, when a storm is predicted like that, we have an entire management staff
Yeah.
who meet and they come up with lists of all the things that are going to be needed to get through a certain number of days. If there are staff that are stranded that can't get in,
Right.
they have ways that help staff be able to at least sleep, and take shifts and things like that. So, and they've got to have extra food and all the things that are daily things that we would have delivered. um, you know, that's something that goes into it too. So coupled on that, imagine, we have inpatients that are staying there to recover. And then on top of that, we're going to try and make some space, as much space as possible for anybody in need. And it's an amazing feat when you're on the inside and you see the workings of the wheels turning and trying to get things done. So that was just an aside, just so people know that there are plans being made when a snowstorm is coming.
What we did during the storm, our homeless vets have to do every day. They have to wonder where they're going to sleep, how they're going to sleep, are they going to be comfortable, what are they going to eat, what is the situation in their environment. So that's just a subset in that small time of what our homeless vets go through every day, just making sure that they're going to be safe in any element, in the heat as well as the cold. So it's a good reminder for everyone of what our homeless vets go through.
So tell me more about your program, because I think it is just the most awesome plan, that has worked, because there are still homeless veterans. So talk about your program and what's available there.
So, the Community Resource and Referral Center is a national program. There are about 32 or 33 in the entire country. So, we're a small but mighty band of believers in what we do. In our particular program, although we focus on our homeless and houseless veterans, we do a myriad of services for any veteran coming through the door. So, we have a food pantry that any veteran can get a bag of food to make sure that they're not food insecure. We also help veterans, connect to food pantries. We do free showers and laundry services for veterans. We actually supply the laundry needs like Tide Pods and the fabric softener sheets, and just a nice area where a veteran can come in and just do their laundry in peace. And we also provide shower services. We provide the personal hygiene products and the changing of clothes that's needed so a veteran can feel good about, who they are, how, where they are, what they're wearing. We
And
have,
also be accepted into society.
yes,
It is as if they are, clean and obviously have clean clothes and things, they're more likely to, you know, go into stores or whatever they're going to do that day. And
yeah,
people are more likely to, just treat them like the public, regular public.
yeah. And we always, the hard part about, being homeless is the reality that there are sometimes stigmas about how a person got there. And, I think the COVID epidemic was a real eye opener that sometimes financial things happen to folks that are beyond their control. Sometimes medical things happen. One incident can change your entire life. And, our veterans, they go through a lot when they're in service. And it's not always a smooth transition or translation back into civilian sector. So what we do is our outreach teams actually go out into the community where our houseless veterans are. We are in the woods. We are in the parks. We are in Baltimore. They call them abandonmeniums, and those are the houses that are vacant that our houseless actually stay in because maybe the water is still running, or maybe the lights are still on, or even not, that they congregate in just to keep warm. And our outreach teams are out there doing that work. And we have liaisons called coordinated entry specialists that work with the community so that we can identify veterans in the community that the VA may not be aware of, but they're aware of, that we can get to them and help them with all the services we provide. And we also at the CRC, if a veteran struggling with their utility bills, we help with that. If they need help with navigating Social Security or navigating motor vehicles, we help with that. The whole idea is any veteran that needs help, we can assist them. And we also have a psychologist and a nurse practitioner within our program. So we want to make sure that all of our vets and our houseless and homeless vets are taken care of and know that the VA is here and we do care and we do understand.
And the overarching arm of the homeless veterans program is also there to help with possible employment, or
Yes.
helping to get somebody employed, or getting homes for veterans, so that it's a myriad of services that are almost tailor made as much as possible to the individual want, need, that kind of thing. Because you probably also face families. It's
Yes.
not just a veteran. You may have a veteran and children.
And that's so right, Terry. So, our program focuses on the whole veteran. In other myriads of the hospital, you may have a focus of just the medical side, or focus of the mental health side, or a focus, of the employment side. Well, we focus at the CRC the whole veteran, including their families. And so we have a program called Supportive Services for Veterans and Families that work with housing couples and helping families, and just trying to do all we can to help whatever the veteran considers to be family. We have vets with pets that their battle buddy is their four-legged friend, you know, and we do what we can to even assist there to make sure there's no separation in that. And so it's being mindful that whatever the veteran considers family, whoever the veteran considers a friend, whatever we can do to assist the whole veteran, that is our focus.
Where are you located?
We are located at the VA Annex, 219 West Fayette Street, and we are on the second floor. And you come up, and we are one of the few locations within the VA in general where if a veteran does not have ID, we can still service them, because we understand that when you're homeless, you're transient, and ID may not be the first thing on your mind, or you may have lost it or something of that nature. So we literally can come down and get a veteran, bring them up, and assist them with all of their needs. And so we are on the second floor. You come up, you're going to hear a little music. We like to have music playing. We give daily lunches out, because the reality is, going to bed homeless and hungry and waking up homeless and hungry is not a position you want to be in. So we make sure that as soon as we open at 8:30 in the morning, that we have everything we need to provide for anyone that's been out there and has a need.
And let's face it, these women and men, they should be second to none. They've provided freedom for us, and that we can't pay them back enough.
And we can't. And that's why, I love what I do, because many times we are the first level of engagement for veterans. Many of our veterans that we, encounter have not been connected to the VA at all. So being able to be that arm of strength, and going out there and saying, hey, we got you. We understand. We get it. Just give us a chance, and we'll show you that the VA is the place that you felt it should be. And like every organization, there have been changes, but there have been good changes as far as making sure that we have the resources necessary to show our veterans that we do appreciate every single sacrifice they've made for us.
Sure. That's always impressed me about you and about some of the the staff whom I've met who work for the homeless veterans programs. They're very passionate, and as well as many of our employees at the VA. A lot of us work there because we have just such deep respect for veterans, and we want to see the best for them, and that's I think that's the least that we can do for them. So they can just walk in. Any veteran can walk in at any time.
They can
I
just
wanna
walk
make that
in.
clear.
Yeah, Monday through
Okay.
Friday, 8:30 to 3, except federal holidays. And they can just walk in and get whatever they need. And like you said, Terry, um, I believe that most of the staff at the VA have been touched in some military way. If they didn't serve themselves, they've had a family member, a spouse, a child, a grandchild, someone that they know has served. And we take that love and we take that care, and we just, spread it more at macro instead of micro. And we just give that same compassion and affection to all of our veterans. And I think that's important. I think it's important that, wherever you work, you really buy into the mission. And I find that a lot of our homeless staff, they stay there a long time because they really buy into the mission, and they get it that what we're doing, you can't measure. You can't measure having someone who was completely homeless and houseless, getting them housed, getting them income, getting them reconnected to family members who may not have even known they were still alive. You can't measure that in numbers, but you can measure that in heart. And I think that's what we experience every day in the homeless program.
So speaking about, before we wrap up,
Mhm.
uh, uh, when you had mentioned family members, what if somebody's watching this podcast and they have a loved one, a friend, a a brother, a son, a daughter, whoever it is, doesn't matter. Someone that they care about is a veteran, and they
Mhm.
know that they're living somewhere in Maryland, probably houseless. Um, can they reach out to you and
Yes.
say, "Would you try to reach out to my friend so and?"
Yeah, we
Does
sure
that
do. We get calls from the community all the time. And someone says, "Hey, I have a family member. Hey, there's someone on the corner that we think may be a veteran. Can someone go out and try to reach them?" So our outreach team does that. Anyone can call 410-637-3246. And again, that's 410-637-3246. That is our main number. And say what the need is. We will make sure that that gets to our outreach team, and we will canvass and see if we can find the individual or contact the individual and get them the help that they need.
Anybody who's watching, we will put that information in the description box down below that. Even if you miss the number, you don't have a pen, just click on that description box. And you also take donations too.
We do take donations. Yes, we take donations. We take canned items, and we take gently used and new clothes. And like any other donation, we provide you the form for your taxes as well. But what may be old to you can be new to someone else. And so if you have that spring cleaning's coming up. And what a wonderful time to give to our veterans. And what's different about giving to us is that we don't charge for the items that are given. Freely we get, freely we give. So whatever you give goes to our veterans free of charge, no matter what it is. And there is no out-of-pocket pay or cost.
Well, Shanita, thank you so much for everything that you do for our veterans. I think myself, and I know tons of our staff, when we pass by somebody who we know or we've seen them there 3 days in a row or something, we know they don't have a home. And, sometimes they're holding a sign saying, I'm a veteran and can you please help? And, especially during the catastrophic weather, it just really hits home how much you need to just function in everyday life. And you at least provide that for these very, very brave and deserving women and men. And I really appreciate it. And, thank you for VAMIX. And we'll be in touch at another time, and let us know if you get some calls and how else we can help. The podcast could help you with
Definitely.
your program.
Definitely, Terry. Thanks for the opportunity. I love sharing the word of what we do. And the more the merrier. We can hold the capacity. If you come, we will answer.